Hello. Have you ever wondered if you want a little extra time for preparation when getting ready for a baby? Well, I'm here to show you how you can buy yourself a little extra time on prep work when getting ready to have a baby. So, what I want to talk about today is amniocentesis testing. For those of you who don't know what it is, it's a very basic procedure. The doctor takes a needle and puts it into the mother's stomach lining and extracts amniotic fluid from the mother's womb. And there's a lot of stuff that they can do with this. So the main reason why mothers get this testing done when pregnant is to answer some questions that they might have about their child that's coming in the future. There's a lot of good things that come out of amniocentesis testing. For one, a lot of mothers can use this to check if their baby has any medical issues or underlying issues that might be an issue when birth is happening. Another reason would be genetic testing. This is a very popular and upcoming use for amniocentesis testing. This is basically looking at the genetic makeup of your baby. For example, if the baby is going to have brown eyes or blue eyes. It's just to look and see kind of what your baby's going to look like. Another pro to amniocentesis testing is you can also do fetal lung testing, which is seeing and making sure that your baby's lungs are at the correct development in that time of the pregnancy or that term. Another is paternity testing. If that wasn't yet known who the father is, there you go right there. You can use amniocentesis testing to figure out who the biological parents are of that child, especially when you get either like a sperm donation, or a lot of women who have trouble having babies do the other ways where it might not be known who the dad is, so you can get that done. And of course, the most basic reason for amniocentesis testing, where it's not exactly testing anymore, but it's also used to get rid of excess amniotic fluid. This is an issue that surprisingly quite a few women deal with when going through pregnancy. They just produce too much amniotic fluid in their womb, so this is a great way to get rid of some of that so you don't produce too much. Now, of course, with any procedure, there are going to be some complications that could occur during this. One of the main reasons why women worry is miscarriage. This is one of the possibilities when getting amniocentesis testing done. However, if you look at stats on mayoclinic.org, it is very uncommon. Yes, it still happens, but the percentages are pretty low, and as long as you are relaxed the day of getting the testing done and you do everything the doctor says, it's very unlikely that you would get a miscarriage. And there's also infection, but if you're with a doctor or at a hospital, everything should be sterile and infection really should not occur when getting this testing done. And then another one is infection transmission. This doesn't happen a lot, but it can. So for women who want to get amniocentesis testing done, but happen to have maybe a blood-borne disease like HIV, you wouldn't be able to get this because when you're putting the needle in the stomach, you could transmit your blood into the womb, which would go to your child, and your child could catch that infection. So, of course, women need to be aware of that when looking into amniocentesis testing. But like I said, there's always going to be cons with procedures, but obviously the pros outweigh the cons, and it just gives you prep time for your child. A main reason why people get this is for the testing on their babies. A lot of people want to know, like, are there going to be health issues, or what it's most known for is testing for Down syndrome. This gives the mother time to prepare and make sure that their baby has everything that they need to be successful in life. So an amniocentesis test can answer a lot of unanswerable questions that women have during pregnancy and can help you get to know your baby before it's even brought into the world. Thank you so much.